Welcome back to New Money this evening discussing healthcare. My guest, Roseanne Harris. If you'd like to email me, my email address is info@anchorcapital.co.za. Before I get to the emails, let's just talk about that issue, about the concern, the belief that if NHI is implemented, you can no longer have private medical aid.
So what the...
Is that real? Is that one of the concepts of NHI?
Well, one of the concepts of NHI is that the benefit package, which is envisaged by for the NHI to provide, will be provided entirely by this single fund model, which will be funded from public resources. So in other words, it'll be tax funding that goes into the NHI, and or funding via some form of quasi-tax, whether it's a payroll tax or whatever the case may be. But it's entirely then funded on that basis in this single fund structure, and that then those benefits that the NHI is not providing are the only benefits that the medical schemes will be permitted to provide. And there's no other country which cuts it off like that, to say that you can't provide those benefits as a private health insurer. It provides a safety mechanism if those benefits can be provided by the private health insurers as well. But be that as it may, the extent of medical scheme coverage is then going to depend on what it is that the NHI can actually provide in that package of benefits. And the NHI bill envisages a phased approach, and during the first phase there will be system strengthening, developing of this package of benefits and so forth, and it's only once the NHI is as what's deemed to be fully implemented that restriction on the role of medical schemes will come into effect. So initially there will be no impact on the benefits of medical schemes. It's envisaged that at some point down the line, but of course that depends on the NHI being in a position to be able to afford a comprehensive package of benefits, and for that to be accessible to the population as a whole.
Roseanne, just comment on, I've seen statements made that there's enough money to fund NHI from various other sources, taking the current budget and various other things. Would you like to comment?
Well, I mean, there's certainly from the Department of Health's proposals and their commentary around the NHI bill, and the mention of raising an additional 200 billion in taxes is, to me, already commentary that there isn't sufficient funding. So, whether that estimate of 200 billion in addition to current health funding being sufficient, that's another matter. But
that's
the
200 billion a year.
200 billion every year. It's a massive number, and that's the Department of Health's estimate. So I'm not sure there's any suggestion that the Department of Health is suggesting, certainly by no means, that they're sufficient for funding NHI. They would need to raise more funding, and of course that's the biggest challenge, is whether our economy can afford that, and whether rather than waiting for that to be the case, there's a number of other initiatives that we can look at that will expand access to health coverage on a more collaborative basis.
Well, I want to pick your brains while you're here. I've got a lot of emails. Leslie says, I would be interested in your view on what medical aid I should join. I'm a lawyer who's fit and healthy, age 26.
Well, excellent that young lawyers are thinking of coming into the healthcare system, and it's certainly...
Where are they coming into?
Yes, and it's certainly prudent to be making and to be thinking about making those provisions for your protection. And I would say that the best thing to do is to get advice from a financial advisor as to which benefit option is going to best suit your needs, and to also help you to navigate through those benefit options, but really great that young professionals are thinking about making that provision.
Well, in some cases, when you join a company that's got a medical aid, it's compulsory. But let's just talk about that, because you spoke about cross-subsidization. This 26-year-old goes into a hospital plan, buys a few insurance-related products, doesn't make the same contribution to the pool that you mentioned early on. Yeah. How's that going to impact?
Yeah, so that's one of the challenges that you see, because we have the system of community rating where everybody on a benefit option has to pay the same contribution regardless of their age or state of health. But if you have medical schemes where, for example, the older people are on the more comprehensive options and the younger people are on the less comprehensive options, you know, the plans that are perhaps just focused on the prescribed minimum benefits, then you're not creating that cross-subsidy because each community is the benefit option. And that's why a concept like a risk equalization fund is usually associated with a subsystem of community rating. So if you look in other markets which have a community rating as part of their regulatory framework, then they also have risk equalization, which helps to make sure that even regardless of the benefit option selection that people are making, that you still preserve the integrity of the risk pool as a whole. So it's a big shortcoming of our legislative framework that we don't have risk equalization, because that would help tremendously. And again, one of the recommendations coming from the Health Market Inquiry was that there should be some kind of risk adjustment mechanism to help with the sustainability of the medical scheme risk pool.
Roseanne, just going back to a statement you made, which I slipped through, but I don't want it to slip through. You said that no other country in the world that's got NHI does not allow private healthcare. Surely that in itself should be saying there's something wrong with the bill.
Yeah, so there's no country that limits the role of private health insurance. You know, you look at, for example, in the UK, where there's a National Health Service, often coming under some pressure at the moment, the National Health Service, something that even if you look at on a purchasing power parity basis, it would be a struggle for us to afford the level of benefits that we have in the that are available in the NHS. But even in the UK, we see increasing take-up of private health insurance, which means that people are able to seek that protection when the National Health Service is struggling to accommodate them. And it's a benefit for everyone, right? Because if some people who can afford it are purchasing private health insurance,
out of the system,
they're out of the queue, and
yeah.
it makes those services more accessible to those who can't afford it. And the problem is that if you don't have that, then that out point is people paying out of pocket. You know, that then when they have a health crisis, if they can't access it in the national health system because there's a struggle with delivery, then they're forced to take on debt or sell assets in order to pay out of pocket, and that's something that we really need to avoid.
Well, people should know in the United States of America, that's one of the biggest reasons for insolvency, is where you owe for healthcare, which can't be refused.
Yeah.
Will doctors not be allowed to provide that sort of advice?
Well, it's not completely clear at the moment in terms of how that those contracts with the National Health Insurance, the NHI fund, are envisaged as to the extent to which doctors would be able to, as they can do now, practice with both public patients and private patients. And you know, what we really need is a collaborative approach between the healthcare professionals, the professional societies, the representative bodies of the doctors, and the Department of Health to come together and work out what's the best way to actually deliver services to the country. And I mean, that's a balance between how you make sure that doctors have access to appropriate equipment and infrastructure to deliver quality healthcare services, but also that the social imperative of making sure that their services are not just the preserve of those who can afford it is also attained. And I think there's a great willingness on the part of the healthcare professionals to be part of those conversations. And certainly for us at Discovery, we're very concerned about the fact that a lot of doctors are anxious and worried about what the NHI means for them and whether they can build their careers here in South Africa. And so, you know, having those engagements and helping them to be part of developing a workable framework, I think is really important. That's our biggest risk at the moment, moment is losing our valuable professionals.
And you're aware of it because you have so many doctors. I mean, you have a percentage close to maybe over 90% of professionals who are networked to Discovery. So you've got that line of communication. Marshall Mslunga says, irrespective of my health, how I manage the cost. Do I get any benefits? Do I pay the same as everyone else, irrespective of their health? In other words, are there any discounts for healthy people? You've answered that particular question. The difficulty is managing it. You know, I've been running this program now. This is my 20th year, and I must have had healthcare on every 6 months at least for 20 years. And every program I say, get yourself a healthcare advisor. Why are people reluctant? Why are they not sitting down with someone who's well skilled, understands the different schemes, helping you into the future to manage your healthcare costs?
Yeah, it's a real challenge, and I mean, you know, the healthcare benefits and the benefit packages, it's complex to navigate. So, as you say, accessing the services of a healthcare advisor is really what you should be doing. And remember that commission is funded by the medical schemes. Yeah. I think what's also really exciting is that the medical schemes themselves, us at Discovery, we're using technology to also help you navigate your health plan. And you know, when you log on to the Discovery app, you will be able to access that support a lot more easily than in the past by using some of those tools. And what's coming, of course, is being able to not just access the information, but also to help you navigate the healthcare system based on what you need. So taking into account, you know, your health status and your location and your needs, that then you can actually navigate the health services that you require. So really exciting that we can use those kind of innovations to make it easier for people to not just access their benefits, but to access healthcare services as well.
You're assuming us elderly people understand how to navigate all that. Well, over the last 20 years, life expectancy has risen from 66 to 73. At retirement, your earning years come to an end, and what you have saved will hopefully provide you with sufficient income in the years ahead. There are important components that one should always strive for. Home paid for, no debt, no more savings to be made, and a good healthcare program. Healthcare inflation is the biggest cost. As one gets older, one's need for the cover becomes more critical. I mentioned if you had a 9% increase in medical aids, every 8 years your premium will double. Do the numbers, as it's frightening. I can only repeat my suggestions over the years that you contract a healthcare broker to help you into the correct healthcare program. Roseanne, thank you for joining me this evening. It's important to note that our program is to provide information and should not be construed as advice. Next week's program will be focusing once again on the short-term insurance industry, and if you need to get hold of me, my details will appear on the screen. Thank you for watching, and good night.